Hi, I'm Dr. Denice Moffat, and I have a website, and I work on both humans and animals. It's called naturalhealthtechniques.com. And part of the website is educational, so we want to show you how you can be the doctor at home and how you can make your health better. So this is our dog Maggie, and today I want to do a videotape on how to show you how to do a chiropractic adjustment at home. Maggie has a little sore on her foot. Now some dogs like this are limping on their foot, but she's not. So what I want to do is show you the process that goes through a veterinarian's brain when they examine the foot and try to figure this out. And the reason why I'm showing you this particular problem is because most veterinarians don't pick up that it's a subluxation of the bones down there, and so they won't know how to do a chiropractic adjustment. So you can put hundreds of dollars into trying to fix your pet, and you don't get anywhere except a limping dog. So Maggie, this is what we're going to do, baby. We're going to come in and we're going to show you what's going on with her foot. So there's a little place that she's been licking on just this morning, right here. And a lot of times what will happen is the dogs will lick off this one little area, and there will be a little bit raised, kind of orangish yellow area, and that's called a lick granuloma. But for her, I just noticed that there's another little place that there's a lick wound, and some of the hair has come off right here. So if this dog were to come into my practice and I didn't know her, I would want to ask a few questions. Well, number one is, how old is this dog? And Maggie's about a year old. Now because of that, I would have to rule out, which means put lower on the list of possibilities, cancer. Because if the dog is an older dog, say maybe over 7 years of age, we would have to put cancer higher up on the list. The other thing that we need to rule out is injury. Now, Maggie isn't limping on her leg, and before we came today, I was watching her in the backyard running around, and she wasn't limping at all on that leg. So I don't think it's a fracture. I doubt that it's a sprain. Okay, but the things that I do know about Maggie is that yesterday we went to the forest and we were running around, and that maybe she got caught in like a log or a stick. Maybe she had like a thorn poke her. So we really do need to look and clip up that foot to see if there's anything in there. The other thing I know is that we just fenced in the backyard, so we've been letting her run around by herself, which we normally are with her in the backyard. And she has a little friend. We call him Gray Cat. And Gray Cat has claws, and Gray Cat doesn't like her sometimes when she rushes up to him. So it could be that there's a cat scratch. Now, if it's a mild infection, her fever will be raised, so we'll go ahead and take her temperature to see what her temperature is. The temperature of dogs and cats normally is 100.5 to 102.5, but that would be in a hot car on a hot day, 102.5, maybe the animal's really excited, doesn't want to be there, is afraid to go to the vet, and now he's got all these people attending to him. So that would be borderline. And anything over 102.5, I would think that there's probably an infection in the system, so that you might have to have antibiotics. And we'll show you how to put some poultices on as well later on. Okay, so right now we're going to clip up her leg and see what's going on. All right, Maggie. Oh, he's a good girl. That's a girl. Hold on. Good girl. Oh, hang on, girl. Hang on. That's a girl. Whoops, 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 whoops. Good girl. All right, hang in there. Hang in there. Yeah, she's doing good now. Okay, got it all clipped up. Now, can you sit up, sweetie? Come on. Good girl. That's a girl. Okay, let's see what we have here. It looks maybe like that might be a little scratch there. There's no swelling in the joint, and when I press on it, it doesn't puff back like there's something injected like pus in the joint capsule. Maybe just a little bit of swelling there. Good girl, Maggie. Okay, so maybe this is just a subluxation. So what I'm going to do is I'm going to use a process called muscle testing, and I'm going to go down and I'm going to see if there's any bones out. Now if there's a bone out, what will happen is my fingers will come apart. And so I'm using her body and intending to ask the question, where are the bones out, if any? And so what I normally do with a case like that is I start on the shoulder and I go down to the elbow and I go to the carpal, then I go to all of the joints, and if my fingers pop apart, then I know there's a bone out. And so if that's the case, then we'll just take her hand and gently but firmly push in that area. Now if you're at home and you don't know how to do muscle testing, a lot of times you can just push each joint in the wrist and just squeeze there and give it a little tug, and that should put everything back in. Okay, Maggie, I can see you're licking away at that. Okay, so let's see if we can bring the camera over this way. Let's check this way. Look up at Daddy. Okay, I'm going to start here on this side, go down. The first thing that's coming is right there, so I know that there's a little bone out of joint there, so I'm pulling just a little bit and pushing, giving a little push. The rest of the foot seems to be okay, but we don't want her to lick that because it's just going to get worse. It's going to get more infected. So what we want to do is we want to try to make a poultice so we can draw out the toxins in that area. Now we can use two things that are fairly common. I believe that slippery elm bark is just awesome, but a lot of people don't have slippery elm bark. And then the other thing we can do is we can go get some weeds from the lawn, plantain, and I'll show you what that looks like. And we can mash up a bunch of those and put that on her. So we're going to take a break and we're going to go get those products and we'll be right back.